Today we learn something about fever. Channel's name is Heartbeat. My name is Dr. Amrit Kejriwal. There are various causes of fever which can be infectious or non-infectious. Among the infections we've got the viruses, we've got the bacterial, we've got the parasitic infections. Chronic illnesses comes in non-infectious disease such as rheumatoid arthritis, heat stroke, drugs, certain medicines can cause fever, and tumors. And also we have vaccines. So these are primarily the infectious causes and these are the non-infectious. And when a patient comes to us, we have to distinguish whether it's an infectious cause or a non-infection cause, especially when we want to differentiate between tumors and infections. Symptoms. So when a patient has fever, they generally don't feel well and have weakness. They may feel hot and sweaty. They have shivering and chills, chattering teeth, flushed face may be present. They may have headache, muscle aches, loss of appetite, irritability, and dehydration. So these are the common symptoms of fever. So when you have to record the temperature, so the temperature can be recorded by thermometers. Thermometers are available in various sites which can be applied: oral, rectal, ear, that is tympanic, and forehead. Oral and rectal temperatures are more accurate measurements, but we must understand oral is acceptable. You can't go and measure rectal temperature of each and every patient. Very inconvenient and embarrassing. Ear and forehead thermometers are less accurate for temperature measurement. So we get mainly the oral that is advisable. And sometimes, obviously, the same oral thermometer can be used for auxiliary temperature measurement. Checking the temperature. So nowadays they're using the digital thermometer and avoiding the glass thermometer. There have been instances where the glass thermometer is cracked within the mouth. So, and mercury has been swallowed. So nowadays they're advising the digital thermometer. Place the thermometer under the armpit or mouth of the patient, and while using a digital device, make sure the tip is cleaned using cold water and soap, and then rinse it, and then turn the device on. The tip is kept under the tongue at the back of the mouth and keep the mouth closed. Make sure that the patient doesn't had any cold or hot fluid in the last 5 to 10 minutes. And if you keep the thermometer in the armpit, then it should be kept very deep. Okay, because sometimes if the thermometer is not kept properly, you will not get the accurate temperature in the armpit also, and the device should be held close to the body. And wait until there's a flash or beep from the thermometer, and then you take it out and read the temperature. Duration. So depending upon the fever, if it is less than 7 days, it is called acute. Subacute if it lasts up to 14 days, and chronic or persistent if it lasts over 14 days. Fevers that exist for days or weeks with no explanation are called fevers of unknown origin. This I am not discussing over here. Severity. A low-grade fever happens when the body temperature rises to 100.4 degrees Fahrenheit, that is 38 degrees centigrade. Moderate fever if the temperature rises above 102.2 to 104 degrees Fahrenheit or 39.1 to 40 degrees centigrade. And high-grade fever indicates if the body temperature is 104 degrees Fahrenheit or above. And hyperpyrexia if the temperature is above 106 or 41.1. Self-treatment. So you can start treatment at yourself. Start with tablet paracetamol, and you may have to repeat every 4 to 6 hours if the fever persists. Take plenty of oral fluids, water, and oral rehydration solution. Alcohol, tea, and coffee are to be avoided. Sponge exposed skin with tepid water and may try to stand in front of a fan. Avoid taking cold baths or showers. There's a difference between sponging the exposed skin with tepid water and taking cold baths or showers. And make sure that you don't go to work and you take plenty of rest. Visit to the doctor. So when you visit a doctor, when there is a fever of more than 3 days in spite of home treatment, high grade fever with temperatures greater than 40 degrees Fahrenheit centigrade, you get a severe headache with the fever. If there's associated vomiting, rash, or you can feel your heart rate increased, or chills or muscle spasms or muscle cramps, then you should visit to the doctor. If you're not able to tolerate bright light, then again you have to visit the doctor. If there's a presence of fits, chest pain, abdominal pain, or pain during urination, then you can visit the doctor. And traveled abroad recently. Even if you're at home and not improving, again you have to visit the doctor. Shivering and shaking. In case you have fever and you have any of the following, then you don't wait for 2 days or 1 day. Go to the doctor immediately. Fever with headache and a stiff neck. Rash that does not blanch to skin pressure and it indicates that it's bleeding into the skin. If the patient has mental confusion or drowsy, difficulty in breathing, various tests can be done. Blood tests, urine examination and culture, throat swabs or mucus sample examination and culture, stool examination and culture, and x-rays. Besides this, there are many other tests which can be done for fever. I am not enlisting them all. Now, while the patient is having fever, you have to maintain the diet, and we have got the principles of the diet. So there's a increased requirement of the body. So you have to give them good nutrition, and it leads to a faster recovery. It's a period of stress, so body needs more calories, and you need a well-balanced diet regime. High calorie diet, protein, low fat, and fluid diet is recommended during fever. Diet. So encourage liquid based like soups, glucose water, juice and milk. Milk can be given if there is only no diarrhea. Give small frequent meals which are given about every 2 hours and gradually increase to every 4 hours. So when the patient starts recovering, you can gradually increase it to 4 hours, but initially give small frequent meals every 2 hourly. Dietary management of fever. Give them fruit juice, milk, tender coconut water, barley water, rice porridge, custard, vegetable juices, soups, citrus fruits, boiled egg, cereal porridges, lean meat, poached or steamed fish can be given. Boiled vegetables. Foods to be avoided. High fibrous foods, fried foods, sugary pastries, canned foods, spicy foods, strongly flavored beverages, thick soups, and ghee. So all these items have to be avoided while the patient is having fever. High fibrous foods, fried foods, sugar pastries, canned foods, spicy foods, strongly flavored beverages, thick soups, and ghee. Treatment. Drink enough to stay hydrated like water, juice, clear soup. Don't take the thick soups. Eat a bland and soft diet that is light on the stomach. Take enough rest. Don't overexert. And if you want, you can take a warm sponge bath. Treatment. Now the treatment depends upon the cause. So if the patient has tonsillitis, it may require removal of the tonsils. If the patient has viral disease, usually respond to antibiotics. Mild bacterial infections may improve by self or may require other antibiotics. And there are various other causes, rheumatoid arthritis, heat stroke, which may require specific treatment depending upon the cause. Tumors, of course, causing fever are very common and we have to see carefully. Prevention of fever. Wash your hands often. Teach children how to wash their hands thoroughly. Use hand sanitizer. Try to avoid touching your nose, mouth or eyes. Cover your mouth when you cough and your nose when you sneeze. So at least others will be not getting the infection. And avoid sharing cups, water bottles and other utensils. Thank you for watching the video. Please do not forget to like the video. Feel free to give comments. Please subscribe to the channel and share link with your friends. Thank you once again.